The latest study comes from the Institute for Health Metrics and Evaluation at the University of Washington. On a national scale, the news is not good. The peak of the pandemic is expected to hit in 9 days. Researchers believe there will be 36,000 more patients than hospital beds, and 16,000 of those people will need ICU beds that are also not available. That's why the national news we hear is so grim. But in Oregon, the picture is quite different. The researchers created a tool that allows us to scroll through the days toward our peak on April 21st. It shows the expected hospital need way below what's available here. Let's take a closer look at that. At the peak of Oregon's outbreak, there will be a need for 227 beds for COVID-19, but there will be 2,600 available. 47 ICU beds needed and 210 available. And 40 ventilators needed. The state has more than 800. It appears social distancing is working extremely well in Oregon.
Oregonians have done a phenomenal job complying with these social distancing measures. We are reducing transmission and flattening the curve.
My colleague Morgan Romero talked with Governor Kate Brown about that over the weekend. The success here is why Governor Brown sent 140 ventilators that just arrived here in Oregon to New York. Washington Governor Jay Inslee sent back 400 ventilators. But if we have plenty of ventilators and hospital beds, why not ease restrictions, especially on businesses? The governor said it's not just about hospital beds. It's about getting enough personal protective gear for the healthcare workers and frontline workers. She also wants to see a period of no deaths for 10 days or 2 weeks.
And number three, that you have testing capacity to continue to test and do surveillance in communities around the state, essentially do contact tracing, determining if there is an outbreak, how it spread, who it spread to, all of those pieces. And you just know from the last piece, the testing capacity, we are several days, probably weeks away from having that ability to do testing surveillance.
Back live now in Northeast Portland, I asked the governor's office this afternoon if our hospitals might become overflow for the rest of the country since they'll have such a huge need and we have open beds. They said they'd get back to me on that one. Back to you.